Welcome to Ask the Doctor. I'm your host, Aldora Robinson, Director of Health Promotion and Advocacy Unit within the Ministry of Health, Agriculture, Sports and Human Services. In studio today, we have Dr. Denise Braithwaite-Tennant, CEO of TCI Hospitals, to discuss some of the frequently asked questions. Welcome, Dr. Braithwaite-Tennant.
Thank you very much. It is certainly and indeed a pleasure to be here, to be able to be on Ask the Doctor and answer these frequently asked questions. I will tell you that these specifically questions were drawn from a recent meeting the governor, the deputy governor, and myself had with members of the clergy. So we compiled these questions from the input that their parishioners had with them, so that we're hoping to answer it effectively for everyone today.
Thank you, Dr. Braithwaite-Tennant. And so let's get right into it. Frequently asked questions. Is the vaccine free?
I am delighted to say that the vaccine is free. And this is very similar to all vaccines delivered by the primary healthcare department and the government's immunization strategy. Now, it is free to those recipients, but clearly not free to the United Kingdom government that purchased it. And as with all other vaccines in the future, if it's the Turks and Caicos Islands that is purchasing the vaccines, it is still passed down free to the recipients.
Right. So the general public would be able to benefit freely, but there is a cost. Okay, so tell us who cannot take this vaccine and why maybe?
Thank you. Based on manufacturers' guidelines and the information that they have to date from the clinical studies on the patients that the vaccine was studied on, and based on the scientific evidence and research, these are the following persons. At this time, it is not recommended to receive the Pfizer-BioNTech vaccine. Those persons who have severe allergies. We do know that there are some people who have mild seasonal type of allergies. For example, they may have if dust in their nose itch, or they get a runny nose, or their sinuses drain. But we're talking about severe allergies and often multiple allergies to where the person has their blood pressure drops suddenly, they get rashes all over their face, their eyes and lips would swell, have difficulty breathing, they may have nausea and feeling to want to vomit. And in order to stop that life-threatening process, they either have an epipen on board where they administer themselves immediately, or they have to be taken to the emergency room for us to administer medication to abort and stop this very severe allergic response. Those individuals are not recommended to have this vaccine. There are other individuals, due to the fact that there's more studies that need to be done in their groups, and that will be children, persons below the age of 16. More studies and limited data is there for those persons who are pregnant. In the same vein, it's also recommended that you ensure that you are not pregnant when you're receiving the Pfizer vaccine. So on the day, we'll be asking you to do a pregnancy test, and once it's negative, we'll proceed, and you don't have any other contraindications for receiving the vaccine. And additionally, it's recommended and advised strongly that you ensure that you're on the relevant birth control so that you don't become pregnant for up to 2 months after your second dose. There are also individuals who have very severe bleeding conditions, and it's not recommended by their doctor that they receive an injection in their muscle. Because this injection is delivered in the muscle of your arm, that fatty portion of your upper arm, similar to us when we were babies and we got our BCG vaccine, that area. So it's going into your muscle. So if the doctor, because of the bleeding problem, says you should not get an injection in your muscle, it is not recommended for you. Those are some of the common ones that we do know so far. Clearly, if you are allergic to the ingredients that are used to mix up the vaccine, that would not be recommended for you to at this time. Keeping in mind there are ongoing studies with various wider patient groups, including children, and these things may change as more information is available, but these are the common ones.
Mm-hmm. So then we are saying that these are specific to the Pfizer vaccine that we are about to...
The ones I recommended are specific to the Pfizer vaccine. However, if the other vaccines are delivered via the muscle, an injection in the muscle, then the person with the bleeding issue would have the same matter.
Same issues, yeah.
Or if it is that the other vaccines have an issue or wanting you to be aware of that very severe allergy reaction we call anaphylaxis. But I will tell you, in the study, anaphylaxis was very rare among those persons who actually got, and even today, after 9 million people. I also, as we both know, that when you're taking any drug or any vaccine, you are at risk of having the same severe allergy reaction, but most people do not.
Exactly. So, children, pregnant women, persons who have bleeding disorders, just should avoid the vaccine at this time.
It's not recommended at this time.
It's not recommended. Right. Until further studies come about.
Exactly. And right now, if people are studying, there are over 30 clinical trials ongoing with various vaccines, and some of those trials are specific to involving children. So the race is on to develop a vaccine that can be administered to some of the groups that are currently either being excluded or not recommended at this time. So there's future and there's hope, but this is what is available, and safety is very, very much important at the forefront, and the experts are going to advise us based on the different types of patients that were enrolled in the study and what they observed.
Okay, well, tell me then. Can you take the vaccine if you have sinus and allergies?
Good question again. So if you have a regular sinus problem, there is no contraindication. In other words, you can take the vaccine. If you have severe allergies, and especially multiple drug allergies, it is not recommended that you take the vaccine at this time.
All right. Okay. So... now, you may find this one kind of like funny, but anyway, the thing is, are there chips in the vaccine to control people? Because there is a concern out there about that.
Thank you very much again for that question, and I don't find it a funny question only because it is a very common question among our patients, a very common question being posed on social media. And we believe the reason why is people are aware of nanotechnology and chip technology, nanotechnology, and because they know that the Pfizer vaccine is encased in a very extremely tiny fat cell. And that fat cell, because it's so extremely tiny, and anything that's extremely tiny in this size is called nano. So it's a nano, meaning extremely small fat particle. And that is what the vaccine is encased. Why did they do that? They do that so it can pass into our bloodstream quite easily, and that the vaccine doesn't get broken down before it enters our cell to help us to trigger our immune response.
Right. And it goes specifically to where it
ought to go.
Yes.
And when it is finished doing its job, that is the people also talk about the mRNA. When it's finished doing its job, it dissolves away from out of the body. So there's no mind controlling associated with this.
Okay. And another question persons out there want to know, is it mandatory?
Thank you again. And that is also a common question, even raised today in a briefing that we were at currently, as it stands within the Turks and Caicos Islands and many portions of this side of the world, it is strongly recommended,
Right.
but not mandatory, as most vaccines are. However, there are some things that has set a precedence before in the past,
Right.
before even this COVID-19 vaccine, where certain countries require you to show evidence of certain types of vaccinations before they give you permission to enter, because they're concerned about their population and the risk of their population, and they may have eradicated that particular disease in their population and they don't want it coming into their country.
Right.
An example of that would be yellow fever. So the fact that some movement or requires you into going into other countries already for you to be vaccinated against certain types of vaccine, and so proof of that isn't really a stretch of the mind to think that that may not be something that some countries may choose to exercise, or the travel persons or the cruise industries may choose to exercise to say they would like to see evidence of vaccination. But currently, it is strongly encouraged, and it is on a volunteer basis.
Okay. All right. That's good to know. But let me take you back to the chip thing, the nano chip. Some people think that, because it is a nano chip, it can take over your body. Can you explain again that that's not the case?
Thank you. And it is not a nano chip. It's not like a computer chip that's going to be injected into your body. It's not an identification chip that will get into your body and you'll be tracked. It's not that. The nano, meaning it is extremely small, that where it comes from. Right. And when people think about people wanting to use either medicine or technology to invade their privacy or gather information on them or track their movements, they have only to look at the device called a telephone in their hand that has GPS positioning capabilities, that has the ability to record or track your conversations over the phone when you call, track your whereabouts when you browse the internet.
TV.
Okay, right?
Alexa, do this.
So technology is already there to track us. They don't need a vaccine to do that, right? But the vaccine does not have, the researchers have not placed the chip in it. It is the nano fat particle, extremely. It's a matter of nano, meaning size.
Very small.
Very small and tiny.
Right.
To enter your body easily.
So, yeah, we're being tracked all over the place. All you need to do is just say, what's your location? And everybody around the world knows where you are, especially if you're on Facebook and all those places.
But we always walk around with our cell phones. Can you think of any of us, if we go to the bathroom, we have our cell phone in our hand?
So true.
Right?
Yep.
So, if it is, we are concerned about tracking. We need to take a closer look at the cell phone.
Right. Okay. Will persons be injected with COVID-19 in the vaccine? Because a lot of people are afraid that you're giving them COVID in this vaccine and they would actually get COVID. Can you explain what it is made up of, or even, clarify for us anyway?
Okay, thank you. And again, when we heard the clergy present this question to us from their parishioners, it is also a common question from our patients and what we see on social media. So, no, we're not injecting the COVID-19 virus to you, the SARS-CoV-2 virus, no. And let's just talk about the new technology this presents and how it's different. Previously, when we are using or developing vaccines, we actually take the actual pathogen that's causing the disease.
Yes.
We grow that pathogen in the lab in various forms of tissue or media, live media, tissue media such as eggs, for example, or animals or rats and mice. And so we grow that, and what we do is we weakened it a little bit, okay? And then you are injected with the pathogen to trigger and activate your immune response so that when you are exposed to the pathogen in the future in its most active form, you have already built up an immune response to it, and you can you can have the disease. You are less likely to get the disease. In other words, you are less likely to get sick from that because you've been forearmed with that protection. With this new technology, and it's, when I say new, for over 5 years now, if people were to do their research, researchers and experts have been finding another way in order to create vaccines without actually injecting people with the very pathogen or bacteria that is actually causing the disease. Right. And so with that is a way to use a piece of code. And that's what all genetic material is. It's a code, using a piece of code, right, to tell your body and that it is actually being exposed to the pathogen without the pathogen being what is you're exposed to, and have your warriors in your body, your natural immune system, to be armed and activated. So it's almost like your body prepares you for a fight even before the fight reaches you, so that you're in a better position. Instead of something coming to you and you're exposed to it, and now you have to gather up all of these natural antibodies and immune cells to fight. So basically you have a fighting chance and you can prepare even before something happens. That's what the vaccine is trying to achieve by doing it this way. And also, with this new technology, it now makes it easier to do mass production of it, because you're not depending on getting tissue or an animal or live cells in order to do that. So you can do it and produce it much faster. And also people are concerned, well, look how fast they did it. Yeah. Usually takes years and years. But if you think about what I just explained, the use of new technology allows you to do that. Well, let's take the difference between a calculator and before there was a calculator. And let's take the difference between using now computers to process data versus you sitting down manually processing the data, right? So the new technology allows you to do things faster, and in many instances allows you to do things better and safer as well. So safety was a primary factor for them, and also the fact that they're using new technology. Many countries also invested in this before even any of the research began. Millions of dollars were invested, and the experts themselves around the world worked aggressively. So to produce something that is new technology, proven safety through the extensive clinical trials, all the steps required, other experts looking at the information and declaring it safe, and it is also effective.
Okay, you went kind of far with the calculator and stuff, but I would stop right at the phone, because look where cell phones have come from. Now you could actually work on your cell phone as if it was your computer. You couldn't do that before. And so it just shows how far we have come as far as technology is concerned. So what people want to know is that if you have already had COVID-19 and your body has fought it off, do they still have to take the vaccine?
That's also another good question, and the answer is yes. When you are exposed to the COVID-19 virus, which is, we call it the SARS-CoV-2 virus, and you get the infection, your body does produce natural immunity, we call it. Right. So how long that lasts, we're not absolutely sure, but you do produce natural immunity. And it is believed that the natural immunity, based on what we can see so far, and more studies are ongoing, it is believed the natural immunity you achieve is actually may not be as long as the immunity we're seeking to induce with the COVID-19 vaccination. What it is recommended is that 4 weeks after, right, you have recovered should be the ideal time that you should go and get vaccinated, and not immediately after your recovery.
Okay, that's good to know. If persons are vaccinated, do they still need to wear a mask?
Yes, you do. Okay? You need to wear a mask because the vaccination program takes time to roll out through the entire community or the entire population that is eligible and suitable to have the vaccine, so that we can build up herd immunity and confirm that herd immunity actually exists. So it does take time. During that time, it is important we continue to abide by the same measures of face covering, hand hygiene, respiratory etiquette, and social distancing. It will take time to build up the herd immunity. So if you've had your 2 doses of the vaccine, and yes, the studies have shown that 7 days after you would start to have the immune response that's required to protect you, you still have to think about the others and the fact that not everybody as yet would have had the vaccine, and herd immunity takes time and it takes numbers. So we should wait to be guided by the experts as to when and what measures we can relax and at what time to keep all of us safe while we are building this herd immunity.
Okay then. So that brings me to the question, why is there 2 shots of this vaccine? You know, I know say one of the vaccines, the the MMR, measles, mumps, and rubella. I think you get 2 shots? 2 shots of that. Yeah, you get 2 shots of that.
Yeah, you get a booster later.
And then you get a booster later. Yeah, but this vaccine with all this new technology, we still need 2 shots?
Thank you very much. And what the scientists wanted to do is to ensure that we have, as best as possible, the most effective vaccine. And what they found is that it requires 2 shots in order for that effective immune response required to get to the 95%. Now, what they're seeing is with the first shot, it appears, because most of the studies, when they study, it goes up past the second shot. It appears after the first shot, when they look at the participants in the trials, that most of them had about somewhere between 50 to 60% immunity. However, after the second shot, 95% protection. So therefore, if we're going to have the most effective protection of the 95%, it is after the second dose. So we're encouraging everyone, ensure that you come back for your second dose.
Okay, well, that's important. We don't want to remain at 50 or 60%, so to have 90%, which is very good. Need to get the second shot. If you have dust allergies, can you take the vaccine? It's an allergy.
Thank you. Well, that depends on what that allergy is doing. If that allergy, that dust allergy, causes you to end up in the emergency room with low blood pressure, swellings of your eyes and your lips, risk that your airway is closing, and I'm describing again anaphylaxis, then you shouldn't. If that dust allergy just causes you to have a runny nose and sneeze, then you should take the vaccine, provided you don't have any other factors such as the bleeding and all of those other things I mentioned earlier.
Right.
If you are in doubt, consult with your doctor.
Okay, yes. And if you have HIV, can you take the vaccine?
We're recommending and strongly doing so that you do take the vaccine, yes.
Okay. And if the vaccine is so good and the UK needs it, so why are they sending it here to us in the Turks and Caicos?
Well, that's a good question. We were definitely asked that question by the clergy, and they got it from their parishioners, as I mentioned, because for something that is so precious and so vital, and when when persons looked at how many deaths are taking place on a daily basis in the United States and also the UK due to this, which is so this why we have to act with urgency to get the herd immunity. But we are in UK overseas territory, and there's an ethical, there's a moral responsibility also to support the UK overseas territory as a developed nation such as the UK. And so we have been very grateful for the many things that they've supplied. It's not only just been the vaccine, and when they rolled out the Pfizer vaccine, as in sending it to us, they were already using it on their population. And in fact, there's such a very high demand for the vaccine that they even themselves are considering how they can do the greatest number of good for the greatest number of people by actually preferentially giving as many people as possible at least one dose. Whereas we, with our small population size of 40,000, are so advantageous that we would be able to have access to enough doses to vaccinate our entire population, and we wouldn't be in a situation where we may have to make that decision of only offering the one dose and along those lines. And we have received ventilators from the United Kingdom, personal protective equipment, many things we have received. This is not the first thing that we've received compliments of the United Kingdom as a part of this COVID response, and especially the hospital. We have received many things that has helped us tremendously to be able to care for our patients. And, you know, we are overseas territory, and they have reached out to all of their overseas territories in a very benevolent and way to support the overseas territories, which I actually think is commendable.
Okay, Dr. Braithwaite-Tennant. Tell the Turks and Caicos Islands if they're being used as test dummies.
Thank you very much. And yes, well, you know, I think we as health professionals and experts in our field might say, where are these questions coming from? You know, but we work with science every day. We are trained in science. We have our scientific minds. So people who don't work in science, you know, and with something that's new, rightly so, would have these, and it's always good for them to express what they're thinking. So no, we are not test dummies. There are over 9 million persons who have already received this Pfizer vaccine, 9 million. And prior to this vaccine being approved by several experts and by several different countries as well. That is the role of clinical trials. And clinical trials is not only just about finding out whether the vaccine is effective, but it's also at each step of the clinical trial looking for any safety issues and dealing with them. So by the time the vaccine is rolled out, any safety concerns are extremely negligible. As with any drug, any new antibiotic, any new goes through these steps, and the steps were robust from the data that has been published and from the feedback from the experts.
Okay. All right. Well, I just have one more question for you. And that question is, if you have to carry an epipen, can you take the vaccine?
Well, the answer is no, because if you have to carry an epipen, that tells me, and that epipen is prescribed by your doctor, that tells me that you have had an anaphylaxis event. And when persons have had an anaphylaxis event, which is extremely severe, life-threatening allergy, when we discharge them from the emergency room, or the doctor's office, if the doctor was able to abort it at their office, we give you a prescription and we show you how to use the EpiPen to administer yourself that medication. So at this time, for the Pfizer vaccine, that would not be recommended for you. Again, if you have queries, speak to your doctor.
Okay. Do you have any final words you would want to leave with the Turks and Caicos?
Yes, I do. Thank you very much. Again, I say as I did on my video because I expressed the sentiments of my medical colleagues, the TCI Medical Association, the TCI Hospital InterHealth Canada professionals. We think of the 3 P's: people, patience, and prosperity. We can achieve good health for our people, protection for our people, no lives lost by ourselves as frontline workers who are exposed, the patients who are in vulnerable groups who might end up with COVID and be in the 15 to 20% who have severe disease and complications and may die, and prosperity. We depend on our service industries, our local economy, and the economy that we get from our tourist industry. Diversification takes time. I'm sure everybody here diversify. This is where the virus is pivoting. But diversification takes time.
Yes,
right now, we need our industry, our economy to be propelled so that all of us can have jobs, feed our families, pay our bills, and live in prosperity. Live in health, wellness, and prosperity. So with that being said, check with your doctor. If your doctor reviews your history and says you are a good candidate to take the vaccine, say, doctor, put my name, my number, sign me up, email Nurse Gardner with my information so that she knows how to contact me with my appointment. Because this is most effective when we all take it. We don't want none of the vaccine to be wasted. None. Thank you.
None at all. Well, we would like to thank you, Dr. Braithwaite-Tennant, for taking time out of your very busy schedule to educate us today on some of the frequently asked questions. We would also like to thank Radio Turks and Caicos and you, our listening audience. I would like to remind you to continue to practice the health protocols. It is important. You need to wash your hands correctly and frequently. You need to wear your mask properly, covering your mouth and nose. And you also need to physical distance when you are in public places. And at this time, with a surge in our cases, we ask that you avoid unessential travel, whether it's to the grocery store, whether it's to Lime with friends. Avoid large gatherings. Just practice the health protocols and keep yourself safe. And if you are experiencing any signs and symptoms of COVID-19, call the hotline. Or if you know that you've been in direct contact with someone who has been diagnosed with COVID-19, call the hotline. Until next time, stay safe.